Have you ever noticed those unexpected drips or sudden urges, leaving you wondering what just happened inside your body? It can certainly feel confusing, but understanding the specific type of bladder leakage you experience is the crucial first step toward finding effective solutions and regaining comfort. When it comes to bladder leakage, which healthcare professionals call urinary incontinence, there are generally four main types: stress incontinence, urge incontinence, overflow incontinence, and functional incontinence. Each of these types has distinct characteristics and underlying causes, which are key to understanding and managing your symptoms. Let us dive into the why behind these different forms. Stress incontinence occurs when physical activity, like coughing, sneezing, laughing, or lifting, puts pressure on your bladder, causing urine to leak. This often happens because the muscles and tissues supporting your bladder and urethra, known as the pelvic floor, have become weakened, perhaps due to childbirth, prostate surgery, or simply aging. Urge incontinence, on the other hand, is characterized by a sudden, intense need to urinate, followed by an involuntary loss of urine. This sensation can be so strong that you cannot make it to the bathroom in time. It is often linked to an overactive bladder, where the bladder muscles contract involuntarily, even when the bladder is not full. Neurological conditions or bladder irritants can contribute to this. Then there is overflow incontinence, which happens when your bladder does not empty completely, leading to frequent dribbling of urine. This type often occurs when there is an obstruction, such as an enlarged prostate in men, or nerve damage that prevents the bladder from signaling that it is full or from contracting effectively to empty itself. Imagine a sink that is always slightly backed up and eventually overflows. Finally, functional incontinence describes leakage that occurs when a person has normal bladder control but cannot reach the toilet in time due to a physical or mental impairment. This might be due to conditions like arthritis, dementia, or mobility issues that make it difficult to get to the restroom quickly enough. So, how can you figure out which type applies to you? The best way to identify your specific type of leakage is to observe your symptoms closely. Keeping a bladder diary, where you note when you leak, what you were doing at the time, and how much you drank, can provide incredibly valuable information. For example, if leakage always coincides with a cough or a sneeze, stress incontinence is a strong possibility. If it is always after a sudden, strong urge incontinence might be the answer. Understanding these patterns is a significant step. This detailed observation, along with a conversation with your healthcare provider, will help them pinpoint the exact type of incontinence you are experiencing. They might also perform a simple physical examination or ask for a urine sample to rule out other factors like a urinary tract infection. Pinpointing the type of incontinence is not just an academic exercise. It directly informs the most effective treatment strategies, whether those involve pelvic floor exercises, medication, lifestyle changes, or other interventions. The benefit of this knowledge is immense. By understanding the what and the why behind your bladder leakage, you empower yourself to have more informed discussions with your doctor, explore targeted solutions, and ultimately improve your quality of life. This clarity allows you to move from feeling uncertain to actively managing your bladder health with confidence and optimism.